The following video demonstrates some of the basic techniques involved in PICC line care and maintenance. Refer to the policy and procedure for detailed steps with rationale. Line flushing and accessing. Gather supplies. Perform hand hygiene, identify the patient, and explain the procedure. Apply PPE as required. Cleanse first microclave clear cap with chlorhexidine alcohol swab for at least 15 seconds and let dry completely. Attach pre-filled syringe to microclave clear cap. Assess patency by attempting to aspirate blood, then inject the appropriate amount of saline using a push-stop motion. Disconnect the syringe and repeat cleansing, aspiration, and flushing for the remaining port. If connecting an infusion to the port post-flushing, connect the IV tubing to the cap using aseptic technique. Ensure that all infusions via PICC line are used with a medication pump and ensure that the IV tubing is labeled. Discard used supplies and PPE, perform hand hygiene, and document assessment findings and interventions. Obtaining blood specimens. Gather supplies. Identify the patient and explain the procedure. Perform hand hygiene and don PPE as required. Stop infusions if any. Cleanse the cap for at least 15 seconds and let dry completely. Attach a pre-filled syringe to the cap and aspirate for blood return, then inject 10 mL of sodium chloride using the push-pause method. Use the same syringe to collect the waste. Pull back on the plunger to the 1 cc mark, allowing the blood to catch up. Continue putting negative pressure on the plunger until you have obtained your desired amount of waste. Disconnect the syringe and set aside for discard. Scrub the hub for 15 seconds and allow to dry completely. Attach an empty 10 mL syringe and using the same constant negative pressure technique, withdraw the appropriate amount of blood required for testing. Disconnect the syringe and set aside for filling of specimen tubes. Repeat cleansing of the cap and flush the port with 20 cc's of normal saline using the push-pause method. Don't forget to flush remaining ports with at least 10 cc's of normal saline. Attach syringe containing the blood sample to the transfer device. Begin filling each tube in the correct order and inverting the correct number of times. PICC line, cap, and dressing change. Gather equipment. Perform hand hygiene, identify the patient, and explain the procedure. Apply mask and non-sterile gloves. Ask the patient to turn their head to the side or also wear a mask. Open all packages and prepare your sterile field. Remove old dressing, being careful not to dislodge the catheter. Open the doors on the stat lock. Carefully lift the PICC line up off the posts of the stat lock. Use alcohol swabs to dissolve the adhesive. And carefully remove the stat lock from underneath the PICC line. Use chlorhexidine alcohol swab sticks to clean the entire surface that will be underneath the dressing, starting from towards the insertion site outwards. Repeat twice more using new swab sticks. Allow the surface area to dry completely. Avoid unnecessarily manipulating the catheter to prevent mechanical phlebitis around the insertion site. Remove and dispose of the old gloves and dressing appropriately. Perform hand hygiene and don sterile gloves. Use the sterile, pre-filled normal saline syringe to prime the new caps and then return the caps to the sterile field. Apply the skin prep to the area under the stat lock. Apply new stat lock by aligning the posts with the holes in the catheter wings and close tabs securely. Remove adhesive backing and apply to the skin. Apply the transparent dressing, crossing the lower edges underneath the lumens to ensure a good seal. Use the 2 adhesive strips to further secure the lumens. Remove old caps and cleanse around the open port with a chlorhexidine swab and allow to dry completely. Apply primed caps and flush each lumen using the push-pause technique. Ensure new dressing is labeled with date and initials. Remove used PPE and equipment. Document your findings and interventions.